Life on the street is horrible. You don't know where you're going to sleep, what you're going to eat, who you're going to meet, whether somebody's going to assault you. You don't know what's going to happen, and it's the worst feeling in the world.
So I remember walking along the streets every day. I had no money to buy even that donut. You'd walk along the street and see that donut in the window and want it so bad because you were starving and you couldn't get it.
I was a street person. I lived in a park.
One night I slept in a public washroom.
And those times I didn't want to live. Those times I wanted to just jump off of something because it was hell.
Everyone needs somewhere to call home, but housing is more than a roof over someone's head. This is particularly true of supportive housing, where people with mental illnesses or addictions have the support of professionals to turn their lives around.
The Dream Team is a group of mental health consumers and family members that advocate for more supportive housing.
In 1995, it's when I met a social worker from one of the shelters who decided to see if I could live independently.
Housing is essential to health, and housing keeps our communities vital and thriving. But Ontario's community-based affordable housing sector, including supportive housing, is at a difficult crossroads. Long waiting lists, 13,000 fewer rental units, higher rents, and capital funding deficits means there is not enough supply to meet the demand. Simply put, many people are homeless or live in unsuitable accommodations.
I have schizophrenia and bipolar, and I lived on the streets in bug-infested rooming houses in the hospital for over 20 years, in and out, in parks, in hostels, in even crack houses. They're the only places I could find.
And there are thousands of people on the street right now that have mental illness or are living on the street, and we advocate for them to get housing through whatever means.
When I first got my apartment here, I started to cry because I thought, who was I to deserve this? And it took me a year to unpack because I didn't believe that I deserved it. And I thought someone was going to come and tell me I had to leave.
It's giving me stability. It's a nice place, and there's parks around there that my son can play in.
Affordable housing means that those who can work contribute to the economy and reduce their dependence on government assistance. So affordable housing is essential to supporting a strong and vibrant workforce and a thriving economy.
My life is better now because I have a job. Everybody in life needs to work because it gives them a sense of who they are. They get their independence, they get the self-esteem from doing something and doing it well.
And it's amazing having that roof over my head that I can call my own. I learned to read, write, and count, and I even got a job, a real paid job.
If you don't have a place to live, you can't do anything. Your health just deteriorates. You spend more time in the hospitals, and that's more expensive. It costs the government more money. They might have to spend money initially on housing, but they save money in the long run on health care, on social services.
The province's long-term strategic plan for health care must incorporate funding for supportive housing, and so should the long-term plans of the province's local health integrated networks.
If I hadn't gotten to housing, I might have killed myself. Now I've got a home, a place I call home, where I come. It's my favorite place in the whole world.
I can help other people. I actually run a food program here. It's just amazing what a loss it would be if I didn't have an opportunity to have this place and give back to society.
Building healthy communities means everyone has somewhere to call home.